Now, authorities of National Health Insurance have condemned the practice by some health facilities which demand money from pregnant women for the medical treatment. It comes after Corruption Watch discovery that in spite of the free maternal health care policy which makes medical treatment free for pregnant women registered onto the National Health Insurance Scheme, pregnant women with NHIS membership actually pay for covered services at the 37 Military Hospital, Mamprobi Hospital, and Mamobi General Hospital. Corruption Watch investigative journalist Francisca Enchel spoke to a woman who, after losing her child, did not have access to the corps because she owed fees.
The policy we inherited was cynically described as cash and carry. That is, if you are not well, you go to hospital and don't have money. Even if you are lucky to get a doctor that would examine you and prescribe, it will be just a sheet of paper given to you, signed by him. Go and find the medicine. If you can't buy it, you go and die. The cash and carry. And we said no, that shouldn't be the thing for the people. So we really worked to introduce the National Health Insurance Scheme. Along the way, we also added the free maternity care.
Pregnant Nana, not her real name, is rushed to the maternity unit of the 37 Military Hospital in labor. She's a National Health Insurance Scheme NHIS subscriber, meaning she did not have to pay for anything under the free maternal health care policy.
The free maternal health care covers maternal health services from pregnancy to delivery and through to postnatals. So when a woman is pregnant, she's covered.
But what turned up was a total cash and carry affair, as she paid for covered services before being provided the needed health care upon arrival at the hospital.
So the health insurance doesn't cover drug
This is private health insurance. It covers when you go for consultation, but not to buy the drugs.
It only covers consultation. Hey!
Ghana country.
Nana and her husband, a farm worker, lacked the finances to pay for the bills, so every bill given to them was followed by phone calls to relatives and friends to beg for money. As if that is not enough, the grieving parents were then hit with another news of the body being detained till a 1,064 Ghana cedis 17 pesos being the cost of staying in the neonatal intensive care unit prior to the death is completely cleared before a death certificate and clearance would be issued for the release of the corpse.
So after paying it,
You bring the receipt, bring the one and pick one.
okay,
They will give you the desserts.
okay.
The NICU bill was not the end of their trauma. While they grieved their loss, they were again confronted with where to find the financial help to settle the NICU and mortuary bills.
That is not right. That is not right. That is not right. So if somebody is admitted to a ward and something happens or the patient couldn't make it, the facility is supposed to submit a claim for the period that the patient was there, the medication that was given, the diagnosis that was given, and the facility should submit a claim and National Health Insurance will pay. There shouldn't be any reason where a body will be held that they have to come and pay before the body is released to the relative. It is not right.
Corruption Watch contacted the 37 military hospital for comments, but as at the time of filing this report, they had not granted an interview 6 weeks after submitting a request.
Let's get on to Zoom because General Secretary of the Ghana Medical Association, Dr. Justice Yankson, has joined us right now. Now, Doc, the death of this child brings into sharp focus ramifications of the underhand dealings of charging for a fee that has already been taken care of by the state. How concerned is the Medical Association about this development, indeed, which has resulted in the death of this little one?
Well, Asa, let me put it this way, that I'm not too sure about the circumstances surrounding, the full details surrounding the death of this child. So at this point, I cannot attribute it to, in quote, funds or otherwise. But I think that I'll say kudos to your investigative journalists for uncovering certain things. But I think that there could be more deeper things we need to look at. Having listened to the documentary, it is clear to me that we need to probe further to find out why the state of affairs or this state of affairs. Reason is that clearly there seems to be a certain structure that you may describe as potentially a co-payment arrangement or payment for some services that either health insurance doesn't cover, or if the health insurance system covers them, then the question is, are there double payments? Let me put this caveat across that I'm not an employee of any of the three facilities that are or were part of this investigative team, and I don't speak for them. I speak for the Professional Association of Doctors because we, as an entity, we are very, very particular about the healthcare of our people. And that is the more reason why we do the work and we take a lot of interest in all matters concerning the health of the people of Ghana. Now, clearly, from what I have listened to, we need to start looking at certain things. One, does the free maternal healthcare services that we want to provide for our people of Ghana truly, truly exist? If it exists, to what extent are services paid for and what services are actually covered? And I think that it will be good for all of us to be made aware the entire gamut of services that are covered. Because not all, let's say, maternal-related matters are simple. Some are complex. And I know for sure that the health insurance doesn't cover for all kinds of complexities that may arise in the course of healthcare delivery. Now, if the policy is that there is true free maternal healthcare provision in this country, especially in our public hospitals, the next question we need to find out is whether the NHIS, as it is now, actually is in a position to pay for all the services that are provided. And if they pay, are they paying realistic fees for those services? Because if you don't pay realistic fees for services, clearly it will get to a point the system cannot cope and service provision will grind to a halt. How often or how timely are the services rendered for, also paid for by the National Health Insurance Authority, knowing that it is very free? Because you cannot be running antenatal clinics, postnatal clinics, doing deliveries throughout the year, and sometimes maybe it may take you up to a year or more sometimes 6 months, 9 months, 8 months before health facilities are reimbursed.
Now, how does the Ghana Medical Association intends to come in here to ensure that we get the clarity you're talking about and also ensure these things will not recur in our hospitals?
That is the more reason why I said kudos for the brilliant job, because this has brought this whole issue to the fore, and we need to be dispassionate about this and ensure that the right things are done at all levels. See, I was glad when I heard that the extra money, in quotes, being paid by our mothers, our sisters who are going for maternal care services were not going into the pockets of individual health practitioners or health professionals, but rather the funds were being paid directly into the hospital or the state's own account with the various banks that are the sites for service delivery in the various hospitals. All monies that are paid into these bank accounts, technically speaking, are monies for the state. The state has overall responsibility for it. Some bit of it may be repatriated to the facilities as part of their IGF reimbursement and what have you. So clearly, the system itself may have condoned or accepted this kind of practice one way or the other. And that is the more reason why for us as CMA, we want to take this up with the Ministry of Health and then see where the loopholes can be plugged. And it will also be fair for a full account of the extent to which services are free in the free maternal system so that we can all also get to know what it is. I know for sure that, for example, we can do a cesarean session that will cost you more than what the NHIS may pay. Or you may provide service that sometimes there are medications that ought to be purchased which may not be on the list of NHIS drug list.
And definitely the clarity will set the matter or put the matter to rest. I'm grateful for your time, Dr. Justice Youngson. He's General Secretary of the Ghana Medical Association.